Hey guys, so this is just going to be an update on my health issues video. So if you guys don't want to watch this one, you can skip ahead to the next one. So it's not going to be edited or cut or anything. It's just going up straight like this. So hopefully I don't screw things up too bad. But as you guys all know, okay, let's rewind and go back to the beginning a little bit. The last couple of months, when Mike and I would go out for like longer distance walks, you guys know in the past we've walked all over the place before, and sorry, I got the hiccups. I've never had an issue, but within recently, over the last month or two, there has been times that we went out and that's just a message on my phone. I can look at it later. We've gone out and I've taken these spells where I'd get dizzy all of a sudden. I'd get like hot and sweaty, and I was thinking hot flashes. It's hot outside, whatever. But then I'd get like, I feel like I was going to faint, and then everything would go black, completely black, and I'd have to like hold on to something to rest for a few minutes, and my heart started racing. That could have been due to anxiety, I don't know, but anyway, it scared me, right? And then by the time I'd get home, I'd be breathing a little bit heavier, having a hard time breathing after a walk. So I had an appointment yesterday with my doctor. Now he has a resident in with him, so I seen the resident yesterday, not my family doctor. So he started asking me a bunch of questions. We went all over my medical history and everything. He checked my breathing, my lungs and everything there. Everything sounded good. So what they decided is my doctor was on call at the ER in my town today. So they decided that I was to go there and meet them there. Pumpkin, what are you doing? So I had to go over there 6:30 this morning to register. And I was there until 1:30 this afternoon. So I was there pretty much all day. So they sent me for different testing and stuff. So they put me in a room right away. I was called in right away. I went for an x-ray on my chest, on my heart. I went for an EKG, and I had blood work done. So they came back and they told me some of my results, and then they left again because they wanted to check something else with my blood work. So they used my blood to check on something else. And then they came back and they gave me the full conclusion. So first of all, my sugar's all over the place, but that doesn't have to do with the dizzy and fainting spells, so I might have to increase my insulin, or I might have to take insulin more than once a day. I said it's been doing good, but I guess my A1C, which is like my 3-month score, was a little bit high, and I said, just give me a chance because I'm doing a lot better now, so I want to, but anyway, they might adjust that, and I might have to take insulin twice a day instead of once a day. Because we need to get that completely under control. They don't want it zigzagging all up and down and up and down. They want it like stable. So I'll do whatever I gotta do anyway. For the most part, it's down, but sometimes it spikes. So we'll have to see. So I might not be able to go to gyms or anything anymore. I might have to be really serious and diligent with it. Sometimes that stuff doesn't affect me, but sometimes it does. You know what affects me more though? Carbs. But anyway, we'll work on that. So that's one area that we got to work at. But the more concerning thing was the doctors both told me that my kidneys are dry. And I'm like, what do you mean my kidneys are dry? Like I'm dehydrated? They said a little bit of dehydration and a little bit because of blood flow going into the kidneys, causing problems with it. And that's what's contributing to my dizzy spells and stuff. So the reason why the poor blood flow in my kidneys is that I have really low hemoglobin, which I've had last year. My hemoglobin was low last year, but now it went up again, but now it's down again. So the thing that they told me all that the first time they came in, and then when they came in the second time, the thing that they had to test was my iron. So my iron is really low. So I have to go next week to have an iron infusion at the clinic. And I don't know if they're going to put me on iron supplements after that or what. But they said, like, I'm going to be watched very closely, basically, by doctors right now. I'm not in danger of, like, passing away or anything. But he did tell me that if I My doctor kind of got after me today. He told me that I'm taking care of everybody else and not myself. So he told me that if I don't smarten up and start looking after myself, I'm going to die a young woman. And he's like, I'm not telling you that to be mean or cruel. He said, but it's reality. You have to look after yourself. Because I've seen myself skip meals to look after Mike. I've seen, I haven't been eating properly. And that's not to say I'm overeating or eating too much junk. I just haven't been eating properly. So, and I'm not even talking about processed foods or like anything like that. I'm just talking about, I'm having quick stuff, I guess because of the summer. But I got to start I'll start cooking home-cooked meals again. And try to keep like things like hot dogs or like something like that, like something that we have as a quick meal. I'll try to keep them down to a minimal. I don't know. So I guess I'm going to be on like a get back to my regular health journey, because this stuff wasn't happening to me a couple months ago. So my biggest thing was I fell off the wagon with drinking water. I haven't been drinking as much water, so that's number one right now on my list. They also told me not to push myself going for walks right now. I was doing really good. I did the shorter block for a full week, and then I did the longer block for one day, but then I went to the doctor and they told me not to. They told me not to push myself. So he said if it's okay to go for the 10-minute walk with the dog if I feel like it's not affecting me in any way, like I'm not getting dizzy spells or anything like that. But he told me not to do any more than that. But he also told me today when I left to take it easy for a couple of days, just to rest up. I told him I had a hard time sleeping last night too. He said it was probably anxiety because I knew I was going over there today and there was stuff going on. So yeah, so Sherry got to start looking after herself, or I'm not going to be much good to anybody if I don't look after myself, right? So I got to do that. Number one is water. I'm going to have to up my water intake for sure. So I guess because I'm dehydrated. So, but that's that's it, guys. I put myself in a very, very vulnerable place here, opening up and telling you guys all this. Showing you guys my flaws, that I'm not perfect, that, even as hard as I try sometimes with my sugars and my blood pressure and all that stuff, I'm not 100% perfect. And that's kind of what spiked the whole issue with going to see the doctor in the first place. My heart rate and my blood pressure were up a little bit out of nowhere. But he told me it has to do with it's because of the dry kidneys. They're under stress, so it was putting my blood pressure up. So I gotta hydrate maybe I should get some liquid IV. Can you get that on Amazon in Canada? Does anybody know? Yeah, maybe I should do something like that because I need to get some hydration into my body. But it is what it is. And like I said, please no mean comments, because I am trying to, I put myself out there. I made myself vulnerable to you guys, so I'd appreciate no bad comments. I encourage well wishes, and if you guys have, basically the golden rule, if you don't have anything nice to say, don't say anything at all. But most of my subscribers are pretty good, and most of you guys are like cheering me on, so I know I can get back there. I just gotta really work hard on it, because I don't want to have kidney disease. I know a lot of people that have gone through that. I don't want to go through dialysis and kidney disease and all that stuff. I don't want to have heart problems. It runs on both sides of my family. My grandmother on my dad's side, my grandfather on my mother's side, and my dad himself had congestive heart failure. So I don't want that. So I got to get myself in a good spot. So, and with the holidays coming over the next few months, there's little treats that I'll want to try, but I really got to limit what I'm doing. So, encouragement, guys. Keep me focused, please, if you can. I'm going to need it, because it's hard to completely change your lifestyle. especially when you're used to having Tim Hortons all the time. I get my tea always has 1 milk and 2 sugar. I don't like sugar twin, and I find it can drive up your sugar just as much as regular sugar. So I'm gonna have to wean myself down on the sugar. So I'll have to get used to drinking tea with just milk in it, I guess. But I will. I'll start by going a little bit less, like every couple of days until I get there, if I have to. Not if, because I have to. Alright, I hope you guys enjoyed this little update. I just, like I said, put myself out there. This is just me being raw, and this is everything. So I hope you guys are all doing well. Take care of yourselves and each other, and I'll talk to you guys all in my next video. Bye, everyone.